Hello, I'm Angela Fox. I'd like to take a moment to tell you a bit about birthing with hypnosis. Many people think of hypnosis as a strange and mysterious process, but it really isn't. Hypnosis is easy to learn. It involves your ability to achieve a deep focused concentration as well as to use your imagination. Having a baby is such an important event in a woman's life that it really is worth your while to learn as much as you can about the birthing experience so that you can plan to have the type of birthing experience you would most like to have. Although I hope to be able to help you to use hypnosis to have a natural childbirth, it is important for you to know that birthing with hypnosis can be used for any birthing outcome, those that are planned as well as unplanned. The most important goal of birthing with hypnosis is the reduction of pain, but equally important is the ability to learn through hypnosis to reduce the fear and anxiety most commonly associated with childbirth in our culture today. In the film that follows, you will see segments of the workshop in progress training several couples to use birthing with hypnosis. You will also hear their feedback after the babies were born.
The primary purpose of the course is to help women overcome the fear that they have about the labor and delivery, and also to eliminate the pain. We're going to teach you how to do self-hypnosis and teach your partner how to accompany you in that process. I'd like to explain to you what hypnosis is because there's a lot of mystery around what hypnosis is. And it's really basically a very normal cognitive function. It's something that we experience every day in our everyday life. For instance, when we're concentrating and we don't hear the radio or the music in the background, when someone calls our name and we're deeply engrossed in a book and we don't hear it. A very good example of what the hypnotic trance is like is, for instance, when you were driving, and you may have remembered when you were taught to drive, that you were not to look at the lights of the oncoming cars, because that movement of the light on the retina will cause you to fall into a sleep even if you're not tired. So what we mean when we're talking about a trance is that we're really talking about an altered state of consciousness, a cognitive function that takes place. It's very different from guided imagery, for instance. Guided imagery is just closing your eyes and imagining something, whereas hypnosis has to do with a separation between the mind and the body. Your body is completely relaxed, and your mind is focused on the imagery that is being suggested to you. So really, basically, you're being suggested in terms of how to feel about each and every contraction that you have. The suggestion comes from me, but it also comes from you, because in the course, you decide what it is you want to feel during each and every surge. We call a contraction a surge. A contraction will only last about 1.5 minutes or 2 minutes. In hypnosis, you're going to experience that as 15 or 20 seconds. As we practice, especially when we practice transition, which is the latter part of the labor, when you go from 7 centimeters to 10, just before you feel the urge to push. What happens then is the surges are coming very quickly, one right after the other. And when those surges come very quickly, your time is going to be condensed. Even in the beginning, when you're at home and you're practicing the self-hypnosis at home, what will happen is that you will experience, and you're trained to experience, each contraction is lasting only 15 or 20 seconds. In the process of being in the class and going through the training, you're going to experience exactly how that feels, because we have a little test, for instance, which your partner will do for you, which is to put a tight clamp on the knee. The kind of clamp that you would not normally be able to endure for more than like 5 seconds. So if he does this, or your partner will do this, and you're not in trance, you'll jump. But you'll find that once you get to that stage and you are trained, you'll be able to endure that tight clamp on the knee for 2.5 minutes, 1.5 minutes to 2 minutes. But what will happen is you will experience that as only 15 or 20 seconds. And you're going to be able to see that your partner's hand will actually ache from producing this tight clamp on your knee, but you'll be perfectly relaxed and in the trance state.
I have great confidence in my birthing companion's ability to help me and be my guide.
The partner is doing several things. He's giving the woman a light stroke on the arm. That stroke is associated with the trance state, the physical contact. The stroke can also be a light touch. If the woman finds a stroking technique uncomfortable, you find what is appropriate for you. But that body contact is a grounding. It's a physical reminder of the trance state. And the partner will do that on cue from the mother that she is experiencing a surge. He can either watch the monitor if she is hooked up to a monitor to show when a contraction is occurring, or she can give him a signal that in fact a contraction is occurring, and he will help her remain in that trance state or deepen the trance state when she goes through transition by using this light touch or the contact on the body. The other method that he has for helping her remain in trance is the cues, the verbal cues, and we give them to you on a prompt card, so that basically when he's in the labor, which can be long, he has the right words to say to her. Many times the partner doesn't know what the right thing to say is, but these words are the same words that have brought the woman comfort when she's been practicing in class or when she's been listening to the tapes at home. The other role that the partner has is to protect the environment, to make sure that the environment is quiet and calm, the music is in the background. You get an opportunity in the last session of the class to practice exactly the way you want to use this technique, so that you role play what you're going to do from the very beginning, the moment that the woman goes into labor, exactly what methods what techniques she's going to use, which tapes she's going to use, what she wants to have happen when she moves into transition, etc. So you get a chance to work that whole thing out like a dress rehearsal before you actually go into the labor.
My breath breathes me and life breathes me with confidence.
In the beginning, it helped keep me relaxed and focused. When I was in full-blown labor, I was not able to be in a trance so as to not feel pain, but I was able to keep my body relaxed and visualize the experience, the journey of the baby. Relatively speaking, we had a very peaceful delivery. While laboring at home, my husband and I were able to keep the room peaceful. I felt calm. I visualized my giving birth long before it happened, so when the time came, it seemed like deja vu. It did become harder as I got closer to giving birth, but by that point, my focus was on just pushing the baby out. It did help, because if I didn't have a focus, or if I didn't know how to calm myself, I know the whole experience would not have felt short to me. It was great. I felt in control of what was happening to me and totally prepared for each contraction. I had the kind of labor that I wanted, at home for most of it, and drug-free. I used it through the whole labor until I was fully dilated. It was most helpful during the strongest, longest contractions. The difference of when I used it and didn't use it was remarkable. I stayed home for almost all of my labor and got through the contractions just fine. When I arrived at the hospital, I was fully dilated, much to my surprise, and started pushing about half an hour later. I pushed for 45 minutes and had the baby. I was rested and focused for the pushing, and afterwards I felt great. I felt in control of my labor and confident because I knew what to expect and what my body was supposed to do.
My breath breathes me and life breathes me with confidence. After my baby's birth, the joy of being a mother makes me more and more beautiful, absolutely beautiful.